Hello, I'm Dr. Stephen Hassan with another episode of the Influence Continuum. Today we have a fascinating psychologist with us, and we're doing the first topic of psychedelics, or otherwise known as entheogens. But I wanted to, Rachel Harris, please, before I introduce you formally in your book, I just want to give a little frame in the background that I recently returned from San Francisco at the American Psychiatric Association conference, and I was surprised, I shouldn't have been, at how many presentations involved MDMA, ayahuasca, psilocybin, and other psychedelic medications for the treatment of post-traumatic stress disorder and other things. And it's clear that there is now much more emphasis going to trying to research, is there a way that these powerful agents could be a tool to help people heal, which is the ethical frame of it. And of course, my work, I've had people contact me because they've gotten involved with cults who were using ayahuasca or using psilocybin or LSD or MDMA in order to exploit and abuse people. And that is my topic. I was introduced to you, Rachel, by a famous forensic psychologist who said, you really should interview Rachel. She's got this great new book out called Swimming in the Sacred. I'll hold it up several times. But first, I just want to give a little bit more background if my listeners are not tuned in to what's been happening, and just say that there are more than 30 million people now estimated in the U.S. that have used psychedelics, according to a 2010 national survey. I think there's a lot more. Best-selling author Michael Pollan wrote about his trips. The National Institute of Health is studying the efficacy of psilocybin and MDMA for treatment of PTSD, addiction, depression, and end-of-life anxiety. And Rachel, you are a PhD psychologist, author of this new book, Swimming in the Sacred, Wisdom from the Psychedelic Underground and Listening to Ayahuasca. Rachel, you've been in private practice for 40 years, 10 years in academic research department, where you have published more than 40 scientific studies in peer-reviewed journals, received National Institute of Health New Investigators Award. And you have your website for your book is swimminginthe.sacred.com. And Rachel, all I can say is that we have a lot of anxious, depressed, worried people about what's happening on the planet with our environment, with lies, and so many people are tuning out and going to psychedelics thinking that it's going to help them know themselves, or that it's going to transform them. And because they don't have a frame to understand what is a good therapy and how to use it ethically, nor are they necessarily aware of real spiritual practitioners who've been using these agents, these medicines for decades. I wanted my listeners to learn from you and your wisdom of your journey. You interviewed women who don't care about money. They're interested in love. They're interested in soul growth, from what I understand. Right? So
well,
you're laughing.
I wouldn't say they're not interested in money. I mean, they do have to survive.
Okay. But they're not selling.
No,
they didn't say, Rachel, we'll teach you if you pay us money.
No, they're really very dedicated. Seriously, they're very they've dedicated their lives, and they've risked their lives. I mean, let's face it. My criteria for inclusion in the study to be interviewed, and the book is based on in-depth interviews. My criteria to be included was that they had to have at least 20 years of experience underground. But most of them had 30, 40 years. The eldest of the elders is now about 90, and she's been working since the early 60s. And just to give you a sense of the ethical commitment, it's the eldest of the elders. She says, Because there's a lot about in the preparation for a journey to clarify your intentions. What do you want to accomplish during? So her statement is, we are responsible for our intentions and our choices, responsible to ourselves and to humanity. So there you hear a very high, excuse me, a very high level of ethical concern that these medicines are not just about individual healing, although that's highly valued. It's also about how can we make a difference in the world.
Right. So it's not about selfishness and, each person is an island. It's realizing we're interconnected beings with ourselves and others and our environment.
I'll read you another quote.
Please.
There's a bigger message coming from the medicine, larger than individual psychological healing. So this is from the underground. They have a very different perspective in contrast to the research teams, which are mostly at medical institutions. Mm-hmm. And so there's a very big difference. And as you pointed out, the underground women have been sworn to secrecy. I'm the first person that they've really welcomed and talked to and opened up. Mm-hmm. And this is not a how-to book. It's not based on transcripts of the interviews. I tried to identify themes after my long conversations with people. And, it was hours and hours of talking to many of the women. I spent a long weekend with one woman. I mean, some interviews were an hour, but most of them were much longer. I would go back and ask questions. And they have a very different orientation than the research teams. And my position is both are needed. We need the hard data. I had 10 years in a research office. Right. I'm very excited about the hard data and how I think it will transform psychiatry. But I don't want to lose the wisdom, the spiritual orientation that these women really have sustained. And one woman said, even if these medicines become legal, I will continue to work underground because that's where the sacred container is. So you get a sense of their lifelong commitment to this process of working with these medicines.
Mm-hmm. And in understanding how these women work, they are journeying with a person, being a guide, using their intuition, using their body wisdom, and really doing their best to enable the person they're guiding to have deep, profound spiritual openings or development.
Yes. But let me just clarify. Yeah, that part is good. But when you say journeying with the person, let's just be very clear that the women in the position of a guide or a sitter, they are not under the influence.
Thank you.
Let's be really clear about that.
Making clear.
Because some people are saying, some of the new sitters or so-called psychedelic therapists are saying, well, I need to have a small dose of medicine in me in order to travel with the person I'm sitting for. And my position is, no, you don't. One person should be straight, just for starters.
Right.
And also, if you have enough experience with these different medicines, you can travel there without the medicine. You can accompany the person intuitively because you know the territory. You do not need even a little bit of the medicine. You don't need it.
Right.
So don't work with anyone who says they're also going to take some.
That's a big red flag, in other words.
Yes.
So, and you really need to check people out. What's their background? What's their training? And have they worked with anyone who has, strong ethical guidelines? Like, for example, hypnosis is everywhere on the internet, and it's not always called hypnosis, guided visualizations, guided meditations. I've studied hypnosis clinically and formally for 40 plus years. And I can tell you, going into an altered state makes you more concentrated and your attention is narrowed, but you're more susceptible to suggestions. So whoever is doing the guided work, if they're not a clinician with strong ethical guidelines and they have an agenda to recruit you into QAnon or make you believe you're a space alien or that you live together, you are married together in a past life. You can't believe how many clients I've had have been told that number. We were married in our past life. Yeah, Chad Daybell said that to Lori Vallow. She just got convicted of murdering her children. And when they first met, he said to her, you know, we were married in a past life. And she bought into. In any case, I don't want to digress too much, but I'm trying to make
I've heard bad
parallel.
stories in the psychedelic world, but I hasn't gotten that bad.
Right. But I just want to make a parallel. As a clinician, I got licensed in 1985. What they didn't teach me in school was to really be a good clinician, I need to be in therapy.
Let's talk about that.
I need to be in therapy with lots of different people with lots of different methods in order to grow myself, in order to become wise, in order to then really be able to sit with someone who's in pain and assist them in a true way.
Let me clarify for starters. The women are more like priestesses. They are really not therapists. One or two of them happen to be licensed, but they keep their underground work really separate. So they are more like high priestesses, if you don't mind the pun. So this is very different. And just in conversation with one of them, I mentioned to them that not all psychotherapists have had their own therapy. And she was horrified. How could that be? How can they do therapy if they have not worked on themselves? And I had to explain it's not always required in a graduate program or to be licensed. So I want to be very clear. These women have worked really in depth on themselves before they did anything with anybody else. And they used the medicines to do their own work. And many of them have been in therapy. And they are not doing therapy with people. They are doing sitting. They are doing guiding. They're doing the sacred work of the journey. They're not doing long-term integration so if somebody has a journey with them and they say, well, I had some issues come up. I'd like to talk to you about it. Most of them would say, either I'll refer you to someone who knows the territory, who's a licensed therapist, or we can do one more journey and see if that helps to clarify it. So, and that's sort of a shamanic approach. And that's it. They do not make those weekly appointments the way I assume we both did. I was in private practice for almost 40 years. So they do not do that. So that's one really important clarification. And they really spent years working on themselves. And even when they were, like, I can give an example of one woman who did a shamanic apprenticeship, which means she worked 6 years with an indigenous Peruvian shaman. And at the point of 6 years, he says to her, "You're ready to sing in the ceremony," which is an important part of the healing process that they do in Peru.
Of ayahuasca ceremony.
This is an ayahuasca ceremony. Yes. Thank you for clarifying. And she says, "No, I'm not ready to sing." So she sits at his elbow, which is the definition of an apprenticeship. You are right at the elbow of the master. And he sings, and she sings a nanosecond right behind him. And so they are right next to each other, and he can say, "Did you see what happened in that person's body? Did you see that energy move?" You know, they're comparing what they're seeing as they're in the middle of the ceremony. So, and that goes on for a year. Then she's ready to sing. And she's been practicing on her own independently for about 25 years now. But that's 6 or 7 years before. You know, the need is so great for psychedelic therapists now that we can't wait 6 or 7 years. So people are being trained as psychedelic therapists with internet courses primarily.
That's frightening.
I knew you'd love that. If they're trained
for just plain frightening.
if they're trained to work with ketamine because that's legal, then they can have access to a ketamine experience or two. But they are not really, they do not really know the territory of of these sacred medicines. They haven't had enough experience in all the different medicines at all different dosages and how it plays out in their own system and their own inner work. And when these elders are sitting with you, it's their presence that's a major therapeutic factor. And that presence is the result of all the work and all the experience that they've worked so many years to bring into their own bodies and their energy field, and how they know where you are when you're traveling. And these journeys are done. The person has earphones on, like I do, and then eye shades. And they're under a blanket often. So you don't have many therapeutic cues. You can look at their forehead. You can't see very much. So you really have to sort of travel with them intuitively. And that kind of skill takes years to develop.
Yeah, I'm holding myself back from just thinking about my own therapeutic mode with clients, with sitting with them and asking them questions and just reading and just feeling what I believe.
See, and even your use of your hand, you're sort of intuiting into their.
Oh yeah, and I'm just totally present with them, trying to help them. And I kind of, in my psychology, I try to enter their world of how if they were raised in a cult and as they're describing their experiences. And I'm building a mental model, but trying to be empathic in that experience with them. Sometimes I get it wrong, but why I'm bringing this up is just that I do a lot of work on Zoom now, but it's not the same as being in the room.
I know.
Being present with someone, giving your full attention, not thinking of anything else, and just really supporting their own growth and journey to break through all of these phobias and traumatic experiences that they've had.
Something's lost when we're not. Yes. When we lose that proximity and that energetic exchange between, something is lost. I know. I feel that too.
Yeah.
And we don't know how to measure that, so we just sort of ignore it because we can't measure it.
And that's a real problem with evidence-based psychology. And I'm like, okay, what's the evidence-based criteria for love?
Well, now you're in my territory.
Well, but you feel it when it's real, but how do you, please, so I really respect you tremendously. You're a psychologist who's also done this journeying yourself, I believe, as you've researched and done these studies. Am I correct?
Well, I had a head start. I was, when I graduated from college, I went to Esalen Institute in 1968.
Right. So that's Big Sur?
That's Big Sur. And there were plenty of drugs around. So I always had a psychospiritual kind of approach. So I was always out in nature. I never did, the big rock concerts and everybody's taking everything. I never did that. So I always had, my own serious approach. But I had never done the protocol that's used where you use music and you're really, everything in the setting is to turn you inward to an inner journey. So when I realized I was talking to these underground experts, the elders, and I had never done a journey in the way that they do it, of course, I signed up. I immediately arranged one. And I did a journey of MDMA. And what was really wonderful about it and new for me because of the healing presence of the guide is toward the end of the journey, and I'm very open. She spent about an hour doing an energetic clearing. This is not something you learned in graduate school, I dare say, nor did I. She used eagle feathers. She'd been trained by Native American adopted grandfather. She used different herbs and smells but an hour really clearing, I'm just still under the blanket and she's working and blowing and fanning and it was wonderful. And that's the sort of thing that happens as part of the what we would call a therapeutic alliance, but that's
Mm-hmm.
part of the value of having somebody sitting right with you and
Mm-hmm.
working with your energy
Mm-hmm.
in that very open time.
Yeah, and I've learned the power of ritual
Yes.
can be so valuable. And with my clients, whether they want to, burn an image of the cult leader who
Yes.
abused them, or
Yes.
do any number of types of reclaiming their personal power for their own moving forward to a new identity and finding out who they are, because that's one of the typical things that I hear from people born in cults
Oh,
and
yeah.
read my books. And they're like, Steve, you were recruited at 19 at the Moonies. You got out at 22. You had somebody to go back to.
Yeah.
I was a creative writing major. I was born in this. Who
Yeah.
am I? What do I
Yeah.
do?
Right.
And so it's really a very precious and I believe sacred trust that people place in me to help guide them and say, you do have an authentic self. You do have a soul. You have a spirit. And it's for you to uncover it, create it, become the best person you can possibly be to fulfill your life and give them hope for a future self.
Yes. So I want to talk about the problem inherent in the psychedelic community at this point.
Yes,
And
please.
because these are women who I vetted, but how do you find them? I mean, I wrote about them. They're totally protected and anonymous. I'm not referring to them. Please don't ask me for a referral.
Right.
My job is to protect them completely. But there are lots of people. There's psychedelic coaching now, which, just my blood runs cold.
Yes.
Who knows what that is? There are lots of psychedelic therapists who were trained online for 4 to 12 months. And for underground practitioners, there has not been an ethical code except what they themselves agree to. And I have to say, many of the women I interviewed were kind of organized, and they would support each other and hold each other to account. So they were not individual practitioners totally off on their own. They had medical people who could help evaluate a prospective client because they do extensive medical interviews, questions about medical and psychiatric history, and can consult with a doctor. So don't go to anyone who doesn't do a comprehensive interview. If they're connected to therapists, licensed therapists, so they can refer out, and they're very experienced. One of the women I interviewed talked about a journey where she realized she had an emergency on her hands. She took that person to the emergency room. Now, by doing that, she could recognize this is serious and we have to go, but also she's walking in and confessing.
Right.
Now, she happened to encounter a simpatico ER doc. So he understood immediately. He didn't report her, but she had to be willing to take that risk.
Right.
Now,
to help another human being who is in danger.
So, but there's no way to enforce this. And if somebody is not licensed, then you don't even have a licensing board to complain to.
Right.
So this is a young community. There are efforts to develop ethical codes and that sort of thing. But it's very young. And there is, because the psychedelics do make people more open and susceptible, there are risks. And there are especially risks in traveling to any kind of retreat center in South America. And what I understand is that the indigenous women, they already know not to be alone with a shaman. They go with a female relative. So there's already sort of a communal safety net that everybody knows that Western women didn't really know.
Yeah,
And
and
some
I've
of the,
heard
I
of
mean,
shamans having sex with vulnerable
and
women who
there
are
are
pretty.
cases of shaman using different medicines to make the woman even more vulnerable. So
Hmm.
datura is a common medicine that can be used that way. It's a very powerful plant medicine that
Hmm.
I would suggest most of us can do without. It's not really part of a traditional ayahuasca mixture.
You know,
Um,
datura is something I believe Charlie Manson used on his followers
well, how
before he
advanced he
sent them.
was. Yeah, I'm not surprised to hear that.
He was also involved with Scientology that the public doesn't know about, although
No, I have not heard
Scientology
that.
says that they're against drugs. But Manson was a cult leader. I'm
Yes.
only thinking of him because Leslie Van Houten has been in jail for 57 years,
Yeah.
and
She's up
hopefully
for
she'll get out.
parole.
Yeah, hopefully. But so can I, as a psychologist, as an experienced person who's researched this, we're starting to name specific things like
Yes.
don't go to other
Warning signs.
countries alone. You know, if you're a woman, never be alone with a shaman that, and how do you decide even where to go for ayahuasca
Well,
ceremonies?
it's all underground information, isn't it? It's all who you know.
Right. So how would the public understand that? So for me, I say don't do it unless you really can go with someone that you know and trust who's, vetted the
And
place.
I would say get as much information as you can and take your time and do a lot of networking.
Yes. I did an interview and a blog post, Rachel, on psychologist abuse, coach abuse, therapist abuse, with like what you should know, what are okay behaviors and what are not okay
Right.
behaviors, and
Right.
questions. And does anything is that something you would ever consider writing up or
Well,
offer?
I'd love to see what you're describing.
Sure, it's
There
on my
is
website,
there
but I'll send you a link.
Yeah, I'd love it. They're just beginning to talk about this, but it's very difficult without legal ramifications,
Right.
without the threat. I mean, there has to be a consequence.
Right.
So if I'm not licensed, who cares?
Right.
And what psychedelics have that I guess cult leaders do too, is this element of inflation where they feel, I mean, I don't want to get political, but where they feel entitled, overly entitled. So there's an inflated ego. And well, for instance, here's an example.
Please.
A friend of mine confronted one of the shaman who is well known for abusing Western women. And she confronted him about it. And his response was, and this is a man who's 70 years old. He said, but it's so easy. So there you have the narcissism and the pathology right there. It's, she's confronting him and he's like, oh, but it's so easy. And
Right.
so
No accountability,
no
no
accountability.
conscience, no empathy,
There you
no
go.
awareness that he's causing harm.
Yes,
He doesn't
exactly.
care. It's
Yes.
about his pleasure and his power.
Yes. So there is a nonprofit organization that has developed a code of ethics for spiritual leaders. Do you know about that group? I can send you.
Please
I'll send
share.
you a link to that group because it's a highly. I think it's called Ethics and Spiritual something.
Okay, well, we're going to do a blog based on this interview
We'll get that
and
on.
include
Yeah.
the video, and we'll add the link for people who are
Great.
listening to the podcast. And
Great.
And
Yeah.
But I'll just say, for me, I've been doing this for 47 years after my Mooney experience, and I'm like, love, honesty, accountability, transparency, being willing to admit if you screwed up, and surround yourself with not yes people, but people who will actually hold you accountable.
Yes.
And having those checks and balances in place. And that's why there's a value to have licensing boards, to at least have a place to,
Yes.
that has
and I'm really saying it's a buyer beware market, and we don't have those control board. We don't have that safety net yet.
Right. Right. And so tell us more about how it's useful with people who are facing the end of their life and having anxiety.
That's the research study that's been done at NYU.
Please share.
And so the psychological term the diagnosis that they were treating was demoralization. It's kind of when the person who's been facing their own mortality, turns their face to the wall and really doesn't want to talk to anybody. So in the time they have left, they're not really living. They lose, they're not able to connect to the people they love. They are just morose and suffer more pain. So with one psilocybin experience, they are better able to remain connected to their loved ones, to use the time well that they have left, and to face their own mortality with greater acceptance and less fear. Now, that's a huge outcome. I mean, one thing the psychedelic researchers have done is they've picked very sympathetic, important populations to study. So they studied PTSD people. It's a lot of veterans who have been and treatment resistant. They've been suffering for decades, and they experience, and I mean, their symptoms are reduced so that they no longer even qualify for PTSD diagnosis. And to treat terminal patients, who doesn't want to give them everything we can give them to help them with their own process of dying, and their pain is reduced. We don't even know how that happens exactly. We don't know the mechanism exactly for that. So you can actually go onto YouTube and look for videos of some of the subjects from the NYU psilocybin study, and they talk about their experience. And I think one woman says, "Well, I was an atheist when I started this, but I've had this experience," and so the quality of their death is much improved. So these are very sympathetic.
I'm assuming these studies are with a therapist who's there while they're doing.
Well, this is part of NYU, so absolutely.
Okay,
so
I just want to be clear. It's not just people who are morose being given psilocybin.
Well,
good luck.
Let me add another caution. So
Please.
The NYU studies with licensed therapists, psychologists, social workers, psychiatrists, there's an intake, there's a preparation of a couple of sessions, there's the sitting, and then there's what they call integration sessions, where you kind of debrief and go over and talk about what it all means. And there are therapists there's continuity in the therapists who are across this time. And this time frame may be 3 months. But I've been hearing, I'm in the psychedelic world, and I've been hearing more who I now call young people, meaning in their 40s, that people are doing journeys alone, home alone. Now, this was, a rule never to do, because who's there for an emergency, or if there can be scary moments, nobody's there to hold your hand or reassure you. But I am hearing more of these kinds of examples. And, most of us who are experienced with these entheogens, we're kind of holding our breath, hoping there aren't a lot of tragedies and emergency room visits. But we don't know what's going to happen as the medicines become more available.
Yeah.
So for instance, in Oregon,
yes, please.
You can be trained to be a sitter you're going to love this, if you have a high school education and you do an online training. So, we don't know how to manage these medicines in our culture. And so we're trying different approaches. I don't want it to be just medicalized, even though that is, of course, by far the safest approach, except that, some of the subjects after the 3-month study and the 3 or 4, so-called integration sessions, they say, I feel like I need more help to integrate this experience. Well, they're now out of the study. So they're basically told, well, go find a therapist. So, there are complaints about the whole range of ways of using the medicines. But the psychedelic elders who I interviewed, they are using them in culturally traditional ways in a sacred context for psychospiritual growth and development. So it is outside the therapeutic structure that, I worked in private practice. It's a transformational approach, but it's a whole different approach to using these.
Yeah.
And our culture, we have to learn how to use these medicines.
Right. We absolutely do. I was thinking about, we now know from the Surgeon General how much social media has a deleterious effect, especially on young people who are addicted to Instagram or TikTok or whatever. Many of them having increased anxiety, depression, and there's an increase in suicide with young people. And I wonder if anyone's tracking the use of psychedelics, that, maybe somebody was doing depressed, anxious, doing a trip by themselves.
We don't know. We don't know.
But we should start tracking
this is
whether
this is what I'm hearing, but
Yeah.
we don't know. And it means asking someone about their own illegal behavior. So you don't always get honest responses.
Right, but if the young people have taken their own life, maybe this needs to be part of an autopsy and a data collection.
I'm sure they do. They do drug screening if someone does a suicide. I'm sure that's true. But you're talking about really younger people and the depression that comes from social media. And I'm talking about 40-year-olds, even though I call them young, they're 40.
Yes.
So it's a little bit, apples and oranges. But what is truthful, just as we don't know in our culture how to use the internet and not suffer with the harm that it can do, we don't really know how to use these medicines. And the first thing we have to admit is that we are learning how to use them. And we need to be wiser about how we use them for ourselves.
Right. So we've talked about the NYU study, and with PTSD, we've talked a little bit about end of life issues, that this might be useful with someone who's properly trained and credentialed. Share some more of the plus sides as you see it, and then we can circle back.
Yeah. Well, think about it. If someone has been suffering with PTSD for decades, think of all the medical expenses that has been part of our national health budget. And it's the same with alcoholism, or the hardest drug to kick is, it's tobacco.
I was going to say tobacco. I held myself back, but yeah.
No, you're absolutely
nicotine and vaping is horrible.
And the health consequences and what that costs us as a nation. So, and they're getting amazing results with smoking cessation. That's at Hopkins. Those studies are at Hopkins because nothing else has worked. Let's face it. And of course they do follow up data gathering, and they check if there's nicotine. They do blood tests. They're not taking people's word for it because everybody has stopped smoking. So they actually do the medical testing. And it's the same thing with alcoholism. I mean, if you think of the car accidents and the cost of the medical care for long-term alcoholics. So these, I really do see it as a revolution for psychiatry. But we are just learning. And what are the best ways to use these medicines? And frankly, what are the cost-effective ways to use them? Now, in Europe, they have had a tradition of psycholytic therapy. Now, that's in contrast to psychedelic. And what that means is you do a lower dose so that your ego remains intact and you can remember more of the journey. And these lower this is not microdosing. It's still you still have a journey, and it's done embedded in a course of psychotherapy. And so maybe you do a journey once a month, and this is over a process of a couple of years. And I mean, I would sign up for this immediately. This, this is a therapist's dream as far as I'm concerned. But this is a major expense. I mean, just to be in therapy alone for 2 years is
Right.
costly. And then to have the therapist sitting with you once a month for 6 to 8 hours, it's a very costly, privileged approach. But this is the psycholytic approach that they've been using in Europe for many years. It's in North America, primarily us in the United States, where we go for these, bigger is better. Let's do, psychedelic doses that will, result in an ego dissolution. And so a lot of the research has been looking at the mystical experience and as the determining factor for healing. So the elders, who I speak to, they've been saying, we're getting phone calls of people saying, I want a mystical experience, as if they're ordering a pizza.
Oh,
And,
wow.
they have, this is part of the education, is they have to understand there is no guarantee that these journeys are unpredictable. And the priority really is to be safe. And
Right.
and that you can't order up a psychedelic experience, or that a bigger dose is not necessarily better. So
It's so valuable what you're saying, and I didn't know about Europe, but I just wanted to comment that they have single payer health insurance. So for them,
maybe,
it's more cost effective
maybe.
to
Yeah, I
and they're
forgot
actually
that.
tracking whether it's working or not with
Right,
people, unlike
right.
our system in the US
Right.
where
Right.
you have 15 minutes to have a session, and write a prescription to big pharma.
Yeah.
And people are not getting what they need. And so many doctors are burning out. That was another thing I learned at this conference. How many, a lot of people are just burning out and leaving.
Yeah. Well, doctors and the nurses even more so.
And therapists too. There's a lot of therapists who just can't take it anymore. And so the need is greater, and there's fewer trained professionals to help them.
Right. Let's talk about ketamine for a
Please.
moment, because ketamine is legal, and there's a ketamine clinic on every street corner now, pretty much, because it's a big moneymaker for the owner of the clinic. And ketamine is not a plant medicine. It's an anesthesia that's used mostly with children, but it's a dissociative. It's not the same as the psychedelic. So it takes you sort of out of your body, traveling into other realms. And it does. Now, I have a prejudice, and it was implicit in my saying it's not a plant medicine. It's a drug. And my prejudice is there are more risks with this. And because it's legal, people are turning to it, and psychedelic therapists can get trained more easily in ketamine therapy. And so a lot of the direction is going in that way, to the extent that there are some companies where you can order ketamine by mail. Do you know about this?
No, I don't. But I really don't know
Mhm.
much about ketamine. I do have a very beloved friend whose daughter has had major problems, and I literally just talked with her a couple of days ago and said that her daughter is so much improved from doing ketamine therapy, related therapy. But I really don't know anything
Well,
about.
that is it. If it's used therapeutically, they're really, again, I'm saying the same thing. They're just learning how to use it. But it can kind of break somebody out of a depression within hours. Now that will redefine psychiatry. So yes, you will hear of these kind of miracle results. But when they're mailing, you can do, this is not an advertisement. You can do a medical intake session on Zoom, and then a company will send you ketamine lozenges that you can take. So I know one therapist who had a client who was getting mail order ketamine, and he wanted his therapy to move faster. So they had sent him a month's supply of ketamine, and he took it all one day.
Oh my goodness.
So yes, so this is the sort of thing that's going to happen. And she told him to go, he called her because he was feeling terrible, and she told him to go immediately to the ER. So, we have to have respect for these medicines. And be a little humble about our own learning process of how to use them. So, there are professionals in ketamine clinics, and so the ketamine is available to them. And there is a risk for abuse of ketamine that they can easily do a journey after hours. So this is a drug that can be very seductive, and abuse is a real risk with it.
Yeah. Thank you for educating me and my listeners about this.
Yes, but at the same time, if you're very depressed and you can get out of that depression this afternoon, that's a miracle.
Mm-hmm.
And even if you need, to not fall back into that depressive mode neurologically, maybe you need 6 sessions within 2 weeks of ketamine.
Mm-hmm.
And admittedly, that can be expensive, but that can knock out a depression. And then
but
maybe
you're talking about people not doing it on their own.
No. At a clinic, a doctor or a nurse practitioner has to be present. A therapist is usually present. Right. And then maybe you need another appointment monthly for a while. Mm-hmm. I referred someone who had major depression. He had extensive therapy when he was at Harvard Law School. Mm-hmm. Now, 30 years later, and he went for this kind of approach of an intensive beginning and then spacing it out. And now he says, maybe I go once or twice a year to the ketamine clinic. Mm-hmm. So I realized I had never experienced this medicine. So, of course, I made an appointment. Mm-hmm. And so I had a medical doctor and a licensed therapist. Mm-hmm. And I had a ketamine experience, and it was a wonderful experience for me. And I was very clear, I never want to do this again. This is not a sacred medicine in the way that ayahuasca is or that the mushrooms are for me.
Mm-hmm. Yeah, it's important to know yourself. And I was interested in your choice of prejudiced versus biased. It was a little stronger to self-identify. That
I think it's
you want to go organic, not big pharma, if I can use that terminology.
I'm not always organic, but yes, in this case.
Mm-hmm. Mm-hmm.
Yeah.
So having spent a lifetime of healing, being a psychologist, doing treatment, doing therapy, any other words of wisdom for our public? Because my experience is people are freaked out, overloaded, uncertain, feel really upset about the polarization politically, but also the rampant corruption in politics and the ecological destruction that's happening.
Me too.
Yeah.
How could we not?
What can we do, Rachel, you, me, and other people who care for the people
all I can say is what I'm doing. I'm doing my spiritual job. And for me, I'm 76. These books, the Listening to Ayahuasca, the Swimming in the Sacred, they are kind of the fruit of my whole life. And so and I feel called to do this work at this time and to use my whole life experience. And it's not like I've had a great, easy life. It's otherwise I wouldn't have been doing therapy or in therapy for these decades. So, but for me, I do feel like this is my calling. This is my spiritual job. And that's all I can do. Mm-hmm. If my spiritual job were to save the whales, then I would be working differently.
Right. So let's say there's a 22-year-old listening to this and they just got their master's and they want to be a therapist. And they really are feeling called by listening to this interview, other than reading your 2 books and listening to your interviews with other people. What advice might you pass on to the younger generation?
Well, I think the advice is what makes any good therapist, and that's do your own work And you said it earlier, that, work in a lot of different therapeutic modalities on yourself.
Mm-hmm.
And then the other thing is, what makes a really good psychedelic therapist is lots of psychedelic experience. So I find myself in the awkward position of recommending illegal activity. But I think you really have to know the territory, and you have to have done your own work so you know how to hold space in that extraordinary territory.
Hmm. So, is there not a path where someone can do psychedelics with a licensed therapist and do it more safely, or it has to be done?
You can go to Holland, you can go to the Netherlands.
Mm-hmm. And
There,
find a therapist and do it
there are
there?
there are training programs for therapists in the
Great.
Netherlands.
Great. Well, that's a big plus, because I'm trying to imagine a younger, therapist who feels a calling to this, to explore and to develop protocols of wisdom that will actually profoundly help humanity to evolve in a very grounded, loving way, integrated way.
And of course, we have trainings here, but they can't involve the use of the medicines. Psilocybin, the magic mushrooms are legal in the Netherlands.
I see.
So the therapeutic training and the experience are done in an integrated process.
Uh-huh. So is there any sense in the future that maybe, Colorado or somewhere
Or
Oregon might do trainings other than online
maybe,
courses?
maybe.
Because it seems to me like there should be a really grounded way to learn.
Well, we have to grow into that. We have to find our way into that level of maturity and responsibility and carefulness.
Mm-hmm.
I hope we do eventually, but it's a very young process right now.
Mm-hmm. Yeah. So we're gonna be wrapping up momentarily, but I want to ask you a question on behalf of somebody who may have had a bad experience with psychedelics and they're afraid to tell anybody about it. Like, how could you advise them how to process or unpack or?
Well, of course, you're speaking to a lifelong therapist, so of course I'm going to say therapy. But you have to go to
But you're not practicing anymore, are you?
No, don't come to me. But you have to go to a therapist who is experienced with psychedelics and understands the territory. And the way to find people like that is through your own networking. And there's pretty much a psychedelic society in every city.
I didn't know that.
Yeah. And so this is just a group with a shared interest. It's not necessarily professionals. Mm-hmm. And you need to go and network and talk to people. And I would get, when I was in private practice, I would get phone calls and they would say, I'm looking for a therapist. Do you do EMDR or some specific technique? Right. Mm-hmm. And I would never answer because it's not about the technique.
Right.
So you have every right to ask a therapist, are you experienced yourself with psychedelics? Mm-hmm. Now, I know you're asking them to admit an illegal activity, but you still have a right to ask.
Right.
And because you really do need someone who understands how things go wrong with difficult challenge, what we call now challenging journeys. But what we really mean is a bad trip where the person gets stuck. And one of the risks is depersonalization, where they feel like they're kind of disconnected from their life and from the world, and they sort of can't re-engage and get reconnected again. And that can last a long time. Mm-hmm. And so if someone is experiencing even a hint of that, they should not they should stop all psychedelic activity, including marijuana. Mm-hmm. And seek to get help. And
I'm glad you mentioned marijuana, because cannabis is legal now in Massachusetts, where I live, and a lot of people experience relief from anxiety by taking, was it gummies or whatever, not just
Right.
smoking. But I've definitely had clients who admittedly were smoking way too much pot and then had a break. Then they were watching YouTube radicalization videos and they had like a, psychotic break between the using too much pot and what they were putting their brain.
Yeah. And,
exposing.
I also worry about brain development. Adolescence, I'm sorry to say, I sound like an old fogey even to myself, I don't think anything should be used until the person's prefrontal cortex is developed. And that's the late 20s.
Yeah, 26, I think, is the latest number, 25,
Yeah.
26.
Yeah.
For the
So when you
average.
think of all the teenagers smoking dope, it's a little worrisome.
Yes, and going to raves and doing, MDMA, ecstasy, etc.
I happen to know Timothy Leary's stepson.
Uh-huh.
Okay. You got the relations, not biological son, stepson.
Right. Okay.
And he said that his stepfather, Tim, advised him not to take any psychedelics till he was older.
Interesting.
So, that's right. Even with all the fanfare of tune in, drop out, whatever, he said, no, wait. And so but are people doing that? I kind of worry about this as well.
Yeah, I have to, since you mentioned Larry, I have to say, the CIA and MK Ultra were the force that made LSD research happen. And Tim Leary was in the very forefront of that research with LSD. It was not, it was really a drug that they were exploring to create the Manchurian Candidate.
Yes, for warfare.
Yes, exactly. And that's part of my background and research is in the military, state operators who are looking for mind control techniques and etc. And a lot of harm was done.
That's a tough note to end on.
Yeah. So let's not end on that. Let's flip it again and tell us one wonderful story.
Yes, I can. So
please.
So the women, in their work with people, they might have a client who comes in once or twice a year.
Mm-hmm.
And so they're working with people who might be using entheogens over a lifespan.
Mm-hmm.
So here's the story about Albert Hofmann, who was the Swiss chemist who synthesized LSD-25.
Okay.
He lived to a ripe old age of 102. When he was 97, he did an acid trip.
Oh, he had never done it?
No, he had done them before, but that was his last one.
Got it.
But the point is not that was his first acid trip, because he spilled it on himself, that's how we discovered it.
Discovered it, right.
But that these medicines can be used over a whole lifetime, different stages of life, and they bring different openings and different transformations at different times in life. And I think that's very important to know as well. And the women, because they've been working underground and they know people, they've been watching how the medicines unfold in a person's life and in their own lives. And this is a whole different approach to entheogens than purely a 3-month treatment and symptom reduction. Mm-hmm. So there are many different ways to use these medicines.
Mm-hmm. Wonderful. Rachel Harris, psychologist, swimming in the sacred, wisdom from the psychedelic underground, author of Listening to Ayahuasca. I'm very grateful to you. Thank you so much for sharing your journey,
Thank you,
your
Steve.
life journey as a therapist, but who's also been involved with, growing and learning and evolving. And I learned a lot. So thank you so much for
this
interview.
Much. Thank you.
Let's stay in touch.
Okay.
Okay, thank you. Steve Hassan here. It's been decades since my family rescued me from the Moonies. I've been at this for over 47 years. The need has never been greater. If you're able, please consider hitting the super thanks button below, and it'll help us to do better. Every penny will help us toward our goal of educating the planet about undue influence. Remember, it's your mind, only you should control it.